Hello, dear friends. I'm Professor Kakhaber Djakeli, and today I'm in wonderful, beautiful city Florence, where International Academic Conference takes place about different type of things, and I represent my topic, what is most actual for my country, for my people. This is diagnostic related groups in healthcare financing. So we have wonderful sunny day, and you see behind me wonderful cupola of the Dome of Florence, great church, established by wonderful, great people from Medici family. So this is the city of Renaissance, and this is the city of great economic ideas. That's why it's very logical to represent the diagnostic related groups as a one of interesting improvement of health economics and health marketing. So when we speak about diagnostic related groups, we can say that this approach really combines two wonderful methods. This is economy of health and this is marketing of health. So we can say that different type of methods to try to decrease the costs were used in different type of areas. And countries, different countries that adopted methods try to decrease the costs. Especially in 1883, the Bismarck model in Germany was established. In 1911, the National Insurance Act in United Kingdom for primary health care was established. In 1948, the beverage model was started. So we will speak about differences about this model, and finally we will go to the way why DRG is right now suitable and rational for Georgia, for my country. So the difference between Bismarck and Beveridge models, we can say in the following ways. A government-run national health service called as Beveridge model can provide care for all at reasonable cost, but can not avoid dangers of poor quality. An insurance-based system called as a Bismarck model can achieve high quality but cannot ensure the health care for all at an affordable cost. To avoid weaknesses of both systems, it's better to use them in mixed way. Right now, let's discuss strengths of social health insurance Bismarck model. So we can say that these strengths in Bismarck model, this is self-governance. Quality of healthcare is high because patients they can choose among different type of providers and they can select best health provider. And co-payment formula also takes place. So in that type of situation, social insurance healthcare model, social insurance health financing model is really better than a state-funded healthcare model. But we can say that this social insurance model cannot limitate costs, cannot reduce costs. So costs right now they are most relevant things in Georgian health economy. So weaknesses of social health insurance system we can also take into consideration. This is high labor costs, high administrative costs, and problems in cost control. So that means that insurance, social insurance model cannot control costs really well. But right now, if we try to combine the best features of Bismarck and Beveridge model, we can say that in that type of situation, we will be more efficient and effective to control the costs and to provide the quality healthcare to our patients. Right now, when we speak about DRG, we can also speak about what is this itself. Diagnosis related groups can be identified as a patient classification system, what tries to equalize the patients with same diagnosis to reimburse them with the same flat payment according to the principles of prospect payment system. As we live in the era of some type of problems in healthcare financing, and especially problems when we want to reduce the costs of hospitalization, to try to reduce the days of hospitalization and make our hospitals to be more effective. In this way, DIAGNOSTIC system is really wonderful, and we can decrease the costs, we can decrease the hospital stay days, and through this type of activities we can be more efficient. So using the approach what is entitled as a diagnostic related group, we can actually decrease costs of hospitals and increase the process of efficiency. Right now, this is the question: how to increase the process of efficiency in hospitals, especially if hospitals they take into consideration Six Sigma marketing approach into their management. In that type of way, they will be really on right way to try to offer quality healthcare, and in the same way be efficient, be effective, and decrease the costs of healthcare administration and healthcare management. So right now, when we speak about diagnostic related groups, this is really one of interesting type of marketing systems what can be used in the state health funding opportunities, in the system of state health funding, what is entitled as a universal coverage healthcare. So right now, when we speak about the systems of healthcare financing, the worst one was capitation. Capitation was diminishing not only costs but also quality of healthcare. But after capitation system was replaced by more advanced forms, the DRG was established, and DRG was established as a one of interesting type of techniques, what was adopted by American Medicare system in 1983, and from that point, DRG develops and DRG is exported to many different countries, and a lot of different countries they step by step they develop their DRGs. But when we speak about DRG, so if we have only one base rate DRG, this is worst one. If we develop the differentiated type of DRGs, in that type of situation, we can offer more quality and more efficiency, more quality of healthcare and more efficient prices to our health financing system. But finally, if we manage to establish the unbound DRG system and really move to different type of base rates and different type of base rate approaches, especially if we try to differentiate little this type of financing, and finally through diversification we established fee for service calculation model and fee for service reimbursement model for healthcare. In that type of situation, from DRG methodology, we step by step will move to value-based health financing, and we will establish the high value for our final customers, patients. So this is the way from capitation to fee-for-service model. All nations they move. Some nations they started right now this model. Some nations they are already finishing the DRG stage, and they finally move to fee-for-service stage. And what is this? This is only according the strength of economy. If economy of the country is really improving, improving and really growing, and the growing rate is steady, In that type of situation, all countries can think about how to establish the fee-for-service model. But still, when we have weak economy and when our economy must grow and grow, the DRG system is really interesting type of system, especially if we move into inbound DRG system and we differentiate different type of patient groups and we establish different type of patient groups, what will finally make patients to try to have more quality type of healthcare and more interesting type of providers of those healthcare to make their healthiness really well. So when we speak about these systems, and about combination of DRG approach to some other systems like social insurance systems, we can say that step by step we will manage fee for service model in our country, and we can say about a lot of type of interesting methods in healthcare financing. The last method, what can be used well right now, this is value-based financing, and so these financing models they can be supported by strong economies and strong households. So, and this type of economies and this type of households can be developed through the ways of competitiveness and through the ways of social improvement, economic improvement, peace, and flourishing of economies. So finally, we can say many interesting type of approaches. They help health economy to find its best systems and to avoid some type of failure to try to develop a lot of interesting type of approaches in healthcare financing. We should experiment a lot, and so we can also use some interesting systems, especially we can develop the state private partnership, and through state private partnership we can also attract private systems what can offer us more liberal type of financing of healthcare, and well developed healthcare model all times has a lot of type of financial bodies what are compete for financing some healthcare costs, and through this type of healthy competition we can finally establish the best system. Once again, thank you very much for invitation to International Academic Conference in Florence, what takes place on 20th of June 2023, and so optimistic ways to improve our economy, marketing, and management I see in conferences, in a lot of type of dialogues between universities, countries, academic systems, and wishing you all the best. Thank you very much. Bye bye.